All right. Thanks, Michelle. Good evening, everyone. It's our Commission on the Status of Women December meeting, December 11th at 7:05. So our first order of business is just to get a motion to, well, actually, we can't approve the minutes because the minutes weren't posted from our November meeting. So we'll just pass that for now. And I guess the next question is really if there's anyone, Michelle, who is waiting to give public comment.
Hold on, let me just change screens and triple check. Oh, yes, there is someone. Diane Lauricella is here with her hand up, so I'm going to pass it to her. Hi, Diane.
Good evening. Can you hear me?
Yes.
I don't know how to put my video on. I don't know if there's a permission, but anyway, you can hear me. So that's the halfway there. Anyway, for the record, my name is Diane Lauricella, and I have lived in Norwalk for about 40 years. And so tonight, I'm eagerly awaiting the content of your agenda with your guest speakers, but I wanted just briefly to speak about two items, mainly one item, item 4C, the Diversification of Boards and Commissions Committee. I think it's terrific to have such a committee. However, currently, I just wanted to make this committee and commission rather aware of some openings that are currently there. And I do believe I do think as in 5B, the monthly listing that I've found on the city website, that was a great start. But in those boards and commissions that I have mentioned before that have perennial issues with a reduction in the number of women on them, I think there needs to be, I would like to work with this commission to pivot and find several creative ways that we could make sure that there is a open-throated request for women to send in their resumes on the following commission. And one is and agencies. One is the Harbor Commission, terrific group, but there's one woman on it. There has been one woman on that commission from the point when I was on it in the 80s. And I think, as you know, when I first met up with you, when you first were created, I said we should strive for what our census, our demographic reveals, which is over 50%. I would love to see us strive for 50% of women to men on all boards and commissions. The Harbor Commission can do better. They have an opening, and I am going out to some women that I know care about harbor and boating and the like. But I would like to work with someone on maybe this diversification committee. I believe there are easy ways to let the public know about these openings. Currently, the same issue keeps coming up where the mayor's office will ask people on the commission or council members, who do you know? Who do you know that might want to be on something like the Harbor Commission? And it comes down again to popularity and feeling comfortable with people. And so while that is very important, I think you're limiting, this commission and the city is limiting who actually serves on some of its boards and commissions. We have the same issue with the Shellfish Commission, a great group of people, all men, no women. Well, there needs to be then laser-like focus on working with that chair and say, how can we at least hold open a couple of seats? And let's really work hard, because women do shellfishing. There are women that care about the issue. And lastly, the Board of Estimate and Taxation. That commission has perennially had maybe, well, not always, but they've had one woman on it. I think we could do much better here. This is a very important commission, and we should strive for 50%. I've said before that currently I believe they have an opening as well. I know Shellfish has at least one opening, but when there are no openings, at some point with advance notice and a lot of fanfare and education, I do believe that this commission can ask some men members who, especially those that have been on a board or commission for a long time, if they would step back or step down so that we can open up more seats for women. And so it has to be more than just the listing in the monthly, but that was very helpful. I'm not saying it wasn't. I just think because we still have this pervasive issue since your founding that I've mentioned, we need to pivot and find tactics that will work in a positive way. And one of those is having literally an article in the paper and on and social media, like an advertisement. We have an opening for Harbor Commission. This is what the Harbor Commission does. And then instructions on who to send a resume to and or a cover letter. And maybe make sure that they copy this commission so you can keep tabs on that. I know they're supposed to send the resume to the mayor's office, but it may get lost in the sauce. So I haven't visited this site, this meeting for a while because I'm still awaiting a personal response to my concerns of my experiences working as an active citizen. I hope in the coming year that we could find a way to heal. I'd like to heal because the experiences I had that I put in a letter were kind of wounding. And other women have similar experiences and have told me they gave up. Well, I don't give up. So I'm hoping we could have a real person-to-person conversation in the very near future in 2024 with you, Madam Chairwoman, or some member of your commission, so we can work towards the positive things I know you all are doing. So thank you for listening.
Thank you very much for your comments and for your commitment to Norwalk and to seeing more women participate in civic engagement in Norwalk. And as you may be aware, the Committee on Diversification did put together a presentation that was presented to the mayor and his office. And it did have a lot of demographic data and some direct requests to the mayor's office to increase the percentages of women on commissions and boards, which is part of the reason why we track that at every meeting. And then we did have kind of a look back, and there has been significant progress. So of course, there's absolutely more progress to be made, but we've had some really productive conversations with the mayor, and just a lot of kudos to Sharon and Jasmine and Christina and the other commissioners on that group who've done a lot of really hard work on that. So thank you for your input and suggestions. Really appreciate it. Okay, so Michelle, is there anyone else waiting to make a comment?
No, there's not.
Okay, all right, thank you. So we'll move on to new business, and we have excited that we'll have a presentation from Margaret Watt and Marissa Mangone. Am I pronouncing that correctly? Okay, and I'll turn it over to Michelle to do a more proper introduction.
Yes, thank you, Claudia, and thank you, Margaret and Marissa. I'm just going to give brief introductions about what Margaret and Marissa do, but thank you so much for joining us. I know when I spoke with Claudia and Shannon, who should be joining us shortly, who's the vice chair, they wanted to bring you all and invite you all to come speak, to have a conversation about mental health and social connectivity. And obviously you all are experts on supporting services for the youth in terms of mental health. And we'd love to learn more about what services you all provide, and then kind of continue having a conversation. The Women's Commission, as you might know, is really centered on filling in gaps, equity gaps, whether that has to do with gender, race, LGBTQ plus issues, and they also care deeply about gaps in mental health services. But I'll let them ask you any questions once you share more about what you do, but some brief introduction. So If you haven't met Margaret Watt in the community yet, Margaret is the prevention director at Positive Directions, the Center for Prevention and Counseling. And their work is centered in behavioral health and prevention counseling and recovery supports for individuals and families that might be struggling with mental health or substance use disorders. And Marissa Mangone is the Senior Officer of Development and Community Partnerships at Mid-Fairfields Community Care Center, where they focus on mental health and support services for children, young adults, and families. And they not only serve Norwalk, but they serve New Canaan, Westport, Weston, Wilton, Darien, and Stamford. And with that, I'd love to introduce Margaret and Marissa to share more about your organizations and your great work.
Thanks so much, Michelle. And hi, everybody. It's nice to be here tonight. And I really appreciate the invitation from Michelle when, Marissa and I are always happy to come and talk about these subjects with anybody. Just to give a little more background. So like Michelle said, I'm the prevention director of Positive Directions. We're a nonprofit on the Norwalk Westport border, and we do serve both adults and children. We're Mid-Fairfield, where Marissa works primarily with children. So we're both coming from an agency perspective where we do provide counseling supports and beyond. At Positive Directions, we do mental health and substance for adolescents and adults, so starting at age 12. My focus is I'm the prevention director, which means I do all the kind of community work. So it's everything from education, community education, advocacy, legislative work, environmental efforts like our liquor stickers, things like that, in various communities. But in Norwalk, I have the CDC's Drug-Free Communities Grant, and that funds virtually all the work of the Norwalk Partnership. So this is where we have levels of things we want you to know about. So Positive Directions is an agency. The Norwalk Partnership is funded through the Drug-Free Communities Grant and also some state money on a more limited basis. But what the Norwalk Partnership is a coalition of many different stakeholders. We have teenagers, we have parents, we have the schools, we have a whole lot of different nonprofits, community college, healthcare providers, the police, everyone, Triangle Community Center, all working together. And our mission is to prevent underage substance use and promote youth mental wellness. So our focus is at the Norwalk Partnership is really on youth and doing a whole lot of different things through these partnerships. Everything from our students, we have clubs in the high schools, and our students did an amazing presentation last week at Ponus Middle School for 8th graders that they put on entirely themselves. They spent like a month of their own time working on it. It was fantastic. We do community things that you may have seen or be aware of, like the Norwalk for Mental Health event. We've had 2 years in a row. Jasmine was there, Marissa was there, or part of the planning. And that's Norwalk, all caps, like a citywide effort to raise awareness about mental health, that we're all in this together, and showcase all the many resources we have by having a big awareness walk, speakers, and a big mental health resource fair. So some of you here on this call have been a part of it, been aware of it. A lot of this work happens through partnership. The other partnership I want to touch on, one thing I'll say about the Norwalk Partnership is because we have the CDC money, we conduct youth surveys every 2 years. So I'll share some data with you in a minute from our most recent youth survey in Norwalk, which was October last year, right around Halloween. That was 2022 youth survey. The prior one was 18 months prior because it got delayed due to COVID. It would have been October of 2020, but it ended up being June 2021. And I can show you that the mental health direction among youth is going in the right direction, but there are still significant concerns. We have also done, but it's a couple of years old now, we did a community survey toward the end of COVID to look at adult mental health in Norwalk. No one's going to be surprised that 43% of adults at that time said that their mental health was negatively affected by COVID. But we actually embedded right in that survey an actual behavioral health screening tool, the PHQ-4 for anyone who knows it, which is a measure of depression and measure of anxiety, that said that at that time, a full third of Norwalkers were reporting depression and anxiety. But we have not updated that since then. So that was during COVID. So a lot of this is to say we have data. It's mostly on youth. We do a lot of work around youth. We're always trying to support the adults. This mental health is, as we all know, a national crisis right now, pretty much. And so the other partnership I want to mention before I show any slides is something that Marissa and I are both part of, which is the Norwalk Acts. And that is another citywide organization that hopefully you all know, another nonprofit involving like 100 different groups, stakeholder groups, working in many areas, but the area where Marissa and I are both part of the leadership team is the Social Emotional Health Committee. And we have braided the work of the Social Emotional Health Committee at Norwalk Acts with the Norwalk partnership work around substance use and the youth data to just tightly say, you know, if you're trying to prevent substance use, it starts with promoting mental wellness, because substance use is a response to, you know, it's like an unhealthy coping mechanism. So everything we're going to talk about is really, I would say, just braided with many, many partners working together with primarily the funding from the Centers for Disease Control. And that grant, since you'll be interested in gaps and future gaps, I mean, I would say we do a lot with very little funding. The grant is $125,000 a year for 5 years. We're now in year 5 of the grant. We will be trying to rebid that federal grant in the next few months and hope to get another 5 years of funding, after which there is no further funding. With the $125,000 and about another $15,000 from the state, that's pretty much all the funding that our city gets for preventing substance misuse and promoting mental wellness among our young people. And again, most of it is funded around preventing substance use, but we look at it as one of our major work plan strategies is supporting youth mental health, because that is where it begins. So in other words, there really isn't any significant state funding or local funding for any of these efforts when it comes to raising awareness, creating environmental change, creating policies, doing the coordination and bringing everyone together. That is a big thing we need to look at as a city, I believe. When it comes to treatment, like the counseling services we provide or Mid-Fairfield provides, there aren't enough treaters out there for the level of need we have. But at least, you know, like if people have insurance, maybe it's covered and so forth. Marissa, I'm going to let you talk.
No, that's a great, actually, that's a great segue. Really appreciate it, Margaret. So Marissa Mangone, I'm actually a lifelong Norwalk resident, born and raised in this community, and live here with my husband and 2 children. And I just am super privileged and proud to be part of this meeting this evening, and really excited to just continue to shine a light on mental health. It's so important, and as a mother and as a parent, and I can think of nothing more important. So thank you all for allowing us to speak. As Margaret mentioned, Mid-Fairfield Community Care Center, formerly Mid-Fairfield Child Guidance Center, is one of the largest outpatient children's behavioral health clinics in Fairfield County. We work with thousands of children and families annually, and have a variety of programs to address the continuum of needs. We work with prenatal mothers all the way to children in our outpatient clinic, which is our largest program. The children can come in with, you know, your junior experiencing significant anxiety, trying to figure out where they're going to college, or a 5-year-old who has been physically or sexually abused and is struggling with significant mental health needs. We also provide care coordination. So we aren't just where we are able to connect families and individuals to not just basic needs, but really looking at natural supports to how and connectedness to how to help families access the resources within the community. We provide intensive outpatient programs, intensive therapeutic interventions, and again, our services run the gamut: prenatal mothers all the way up to age 21, And then we recently got our adult license a couple years ago because we had found that there were so many young adults that did not have access to services. There aren't many in the community. We accept all children and families regardless of their ability to pay. And so offer a sliding scale, Medicaid, private insurance. But as you can imagine, it's incredibly expensive. And so we are seeing more and more families from what we call this mid-market, where they can't afford to pay, you know, $350 a week for private therapy, but yet don't qualify for services. And so it's a really difficult challenge. And I think one of the things I love most about Norwalk, and Margaret touched upon it, is the partnerships that we as a community really work hand in hand with one another and really try to support the needs of our community. And it's something that I'm incredibly proud of. And I know Margaret's going to share some of the data, but it is astounding. Again, as a parent, it's hard to see, it's hard to hear. And when we're talking about equity and accessibility, there are significant gaps, and it's pretty staggering and significant. So I don't know, Margaret, if you want to share some of the data, or if there are any questions at the moment.
I'll go ahead and pull up my screen. Let's see. Can you all see this?
Yes.
Yeah, okay, thanks.
Yeah.
I can't see you anymore, so if you're nodding. Okay, so here are the Norwalk Partnership and Norwalk Acts logos, just as a reminder that those are the two big sort of coordinating bodies that we spoke about. And I would definitely encourage you, if you're not already, to subscribe to both websites, so you'll get, like, you know, maybe once a month you'll get an email blast with information about things that are happening, new resources in the community, and so forth. I wanted to start by pointing out that among youth, the youth mental health trend has just been going sort of from bad to worse for a number of years. This was from an article by the CDC last January, pointing out that for 10 years prior to the pandemic, young people were reporting higher and higher levels of what we would call depression, right? Like when you report persistent sadness and hopelessness, and also suicidal ideation and suicide attempt. And that had increased by 40% before the pandemic. So some of the, you know, no one knows exactly what this is all about, but there are a host of factors that have been suggested, from the impact of social media, iPhones, the iGen, if anyone's read that book, iGeneration, the Black Lives Matter movement, the types of violence that we were seeing and witnessing all the time, lots and lots of anxiety about climate change, the political climate, which has been, you know, pretty awful for a number of years now. And then a positive rise in people being able to sort of express alternate sexual and gender identities, but then being met with a lot of discrimination. Then you had COVID hit. So I'm not going to talk about this survey, the demographics from our survey, but I have it if anyone has any questions. Just to show you some of the data from last October, we did survey almost 4,000 students in 7th through 12th grade, excuse me. And this is just a slide to show you that things are going in the right direction. Your blue bars here are showing you what our students reported last October, and the orange bar, or rather, sorry, I can't see my own, the Zoom bar was blocking my very own x-axis. Okay, the orange bars are what we were seeing last October, and the blue bars are what we were seeing in June 2021 at the prior survey. So what you're looking at here is depression dropped from almost 40% of everyone in 7th through 12th grade to 23%. So that is terrific. That's really heading in the right direction. All the work we've done as a city has made an impact, and also life just kind of renormalizing. This level of depression is close to what it was right before the pandemic. However, and I know Marissa and I have talked about this, so she'll agree with me, the kids who are still experiencing depression are much more acutely depressed. There's a lot more, it's not, you know, at the level it used to be.
And I'd also,
So-
can I just Margaret,
Please.
can I also add to that, that while we're talking about 7th through 12th graders, when Margaret talks about acuity and intense, persistent sadness, hopelessness, we are seeing younger and younger populations. So you have your 6, 7, 8-year-olds that are saying that I do not want to live, I do not want to be here. So I just wanted to kind of level set that as well, that is what we are seeing.
Yeah, thanks for adding that. And Mid Fairfield sees that all the time. And I mean, I've talked to people at Norwalk Hospital who've had 5-year-olds come in who have attempted suicide. So our data, we just have our youth data is 7th through 12th grade. So we don't have the lower numbers as a survey, but the providers who treat the young can tell you. As you can see here, suicidal ideation and suicide attempt were not too different from what they had been. But generally, you know, things are getting better for many, and then there are these pockets, right? So what we are seeing more recently is that 23% of students overall were reporting depression. So what was even more popular, not popular, but commonly reported, more prevalent, was anxiety, and anxiety at levels that are really interfering with the ability to learn, the ability to be present, the ability to live their daily life. So over a quarter reporting very high levels of anxiety almost all the time. 11% of our kids had considered suicide, 12% reported they were self-harming. And then we had not previously measured, this is self-reporting of irregular eating disorders or behaviors, but over a third were reporting that, you know, they were limiting their calories or binging or, you know, exercising sort of dramatically. They were given a description, and 35% of them said this. So this is something the schools are working on as a result of the survey.
And Margaret, I'd also just like,
from an equity lens.
Sorry, Margaret, I just wanted to add from the eating disorder perspective, it's also not just young women and girls, we're also seeing some young men exhibiting that behavior as well.
Yeah. We added that to our survey this last year because so many clinicians were telling us after kids came back to school following the initial COVID part, so many of the clinicians were saying we're seeing girls and boys reporting, these behaviors. And so we measured it and it was very high. And it was still higher among girls, but it was higher among boys than I think you would have seen traditionally. So from an equity lens, this is taking that same 23% depression level and showing you, when we disaggregate the data, that the trans or non-binary kids, 50% of them, literally half of them, are reporting depression. The kids who are lesbian, gay, bisexual, or self-identify, so this is sexuality versus gender, 40% of them. So the LGBTQ population at large is reporting a lot more depression, a lot more suicidality, a lot more substance use than straight cisgender people. However, this again is looking better. These data are looking a lot better than they were the previous survey, when 75% or 73% of our LGBTQ population were reporting depression. And one thing I want to highlight is the youth survey data that we have, thanks to the CDC grant, has brought in resources. The schools, Norwalk Public Schools, really responded to this survey. We did presentations all over the place, starting with the Board of Ed, and resources were added to the schools, an LGBTQ counselor in both high schools, more free, crisis counselors available in the schools, now also more in the middle schools. Even now they're trying to add a licensed alcohol and drug counselor to the high schools. Just really, resources have been identified, grants have been gotten. The community providers have contracts with the schools to be embedded in the schools, not as school employees, right? But like just nonprofits in the schools that the kids can just walk in the door and access support. So that's amazing. Women's Commission, you'll be interested to see that, pretty much a third of girls were reporting depression. Again, it was higher the previous survey. And then this purple line is students with IEPs. That's students in special education who receive an individualized educational program. So my kids, I didn't mention, but I also live in Norwalk, and my kids did K through 12 here. They're both in college this year for the first time. And one of them has an IEP, and Marissa has a child with an IEP. So when you see that the special education population is at much higher risk, that's hard to see as a parent. I have similar graphs to this that I didn't bring along tonight, but looking at just suicide, and pretty much the same kind of marginalized populations have much higher suicidal ideation rates, suicide attempt rates, substance use, etc. So I'm just going to share a few other factors from our data that are related to mental health. So our kids have experienced a fair amount of trauma in their lives. You know, if you are a victim of violence, if you've experienced discrimination, housing, or food insecurity, those are all factors that correlate to your mental health. This is what kids told us, what percentage of them had experienced these problems. The blue was in the year prior to the survey, and the orange was in their lifetime. So you can see that violence and discrimination are really major factors for a lot of kids. I'm going to have a slide on each of these because we want, you know, to gather data when we can about the things that are positive that we can increase, and also the things that are maybe missing. So a huge factor in everyone's mental health is their social connectedness. And most of our kids reported that they had an adult and a peer that they could share their feelings with and talk openly to. But both during COVID and after, there was an impact on how connected they felt to kids at school and to teachers at school. If you ask them about just not the kids they were already friends with, but just other kids, and only half, even last year, only half felt connected to anybody else at school, really. And what you see here are the actual numbers of students who said they had no adult that they could talk to about anything in their life, and among whom about a third said they also had no peer to talk to. And those are very concerning numbers, because I think with everything everyone's going through, if you have no one you can turn to, you are at extremely high risk. One of the things we've done with the Norwalk Act Social Emotional Health Committee that Marissa and I are both on the leadership team of is we are trying actively, we've started last year, we're trying very carefully to identify anyone in the city who's working in some youth serving capacity, like Jasmine, and say, okay, how can we reach every adult who is working with kids? They could be that one responsible adult that the kid would turn to. They may be the only person that kid would turn to. So how do we make sure that they have the knowledge and the skills to support that kid around mental health? How do we make sure that person is culturally competent in LGBTQ issues, is suicide prevention trained, and a whole host of other things. So we actually organized the first day of training for the youth serving providers last year. We're doing a survey of them right now. We're working on building this up and trying to have everyone commit to saying, if you're a mentor with the Norwalk mentoring program, you're still going to have the same basic list of competencies to support our kids. I'm only going to share a couple other slides here, but I thought you'd want to know, things that support our mental health are being, engaged socially, being active, feeling meaningful. So it's relevant that about 40% of our kids spend, significant numbers of hours every week alone and unsupervised. Most of them get physical exercise, 80%. That still means 20% report getting basically no physical exercise whatsoever. 9 out of 10 said they were involved in some type of extracurricular, although the primary one was helping to take care of a family member or doing chores around the house. And of all the different options we gave them for telling us how they use their time outside of school, they mostly, for whatever they were engaged in, it was usually only 1 to 3 hours a week. So that, to me, says there's a lot of clubs and jobs and volunteer internships and things where they learn new skills and connect with others and feel important and like they're making a difference. And then just some substance use data, because of course that's what we're funded through. Substance use in Norwalk has been, and nationally has been dropping for years among youth, but it got rock bottom last year as a result of COVID. I think all the kids, anyone will tell you, kids are probably 2 years behind when it comes to their social development. So they're not partying. Like if they're 12th grader, they're probably more like the rest of us were as 10th graders. And if they're 10th grader, they're probably more like an 8th grader. And that is protective in some ways in terms of substance use. It does look like this has started to climb again a bit this year. It really didn't have anywhere to go but up. But it's good that our kids haven't been turning or have had a little bit of a break in terms of using substances to cope with their problems. And then I think this is the last data slide I was going to share because people are always curious about bullying. What you're looking at here is, first start with the bullets and not the pie charts, that over half said they'd never been bullied. I mean, wouldn't it be nice if that was 100%, right? But maybe that's better than people would think. Basically, 4 out of 10 said they'd been bullied at some point in their life, and less than just about 1 in 10 said they'd been bullied in the prior month. Girls, Hispanic youth, and LGBTQ youth had higher reports of bullying. And what you're looking at with these pie charts is when kids witness or experience bullying, how often did they feel that a teacher or an adult would intervene? And that's the pie chart on the left. And how often did they feel that another student would intervene? And I think, what's sort of depressing here is that the light blue and the yellow, which are almost always are, about a third of the time did they think that a teacher could be counted on. So there's also room for improvement in that area. Just to leave the data behind and say, what are some of the things that we try to do as providers, as the Norwalk Partnership, as Norwalk Act Social Emotional Health? We're trying to encourage healthy lifestyles. There are so many ways, whether it's, the use of time, the social activities, exercise, etc. One of the things that the city has given us money for this year is our Teen Nights Out initiative, which we have teens leading, but it's for high school students. And every month there's a big free, fun, social, substance-free activity. This month we have a bowling night, and we've got 155 kids signed up as of right before this call. We make resources available all the time. This is a video that is updated constantly. It was just updated last week, and the schools have it, and the health teachers have it, and the kids can watch it. It's about 2 minutes long, and it goes through all the hotlines that are available to them for different things, all the in-school free resources, and all the community resources that are free and available to them. And trying to go to the next slide, and it won't. Oh, because it's hidden for some reason. And then the last thing I was just going to show is on the Norwalk Partnership website, we have a regularly updated list of all the behavioral health resources, so mental health and substance resources available in Norwalk. And what I want you to see here is all this stuff that's free in the schools, the free city services, the support groups, and then all of these are the nonprofit agencies just in Norwalk. So to quote the Teen Talk counselor at Norwalk High, we are a city rich in resources, but it's always about raising awareness and connecting the dots, and then identifying the vulnerable people and getting them connected to the resources. So I want to stop there and see whether you'd like to ask questions about any of the data or just dig into specific questions. I guess that what I'll say is that, alluding back to the Norwalk Partnership and Norwalk Act Social Emotional Health, we try to work across a whole continuum of strategies: education, support, looking at consequences for, negative behaviors, looking at the policy environment, a whole lot of everything. So it's individual strategies, it's environmental strategies. What we need there, besides continued sustained funding and coordination of that kind of work, is just more people, more parents, especially. The providers work together so closely and really well, and our relationships just keep growing with everybody in town. But a lot of this is, the end users of our efforts are really reaching kids and reaching families. And we can reach kids to a certain extent because they are in the schools and we are collaborating with the schools. So for example, I go into schools and teach suicide prevention to the high school kids so they can actually, you know, be that peer who sees someone say something on social media and they reach out and they help. We do put together these activities and awareness programs for parents, and we all know how hard it is to find time for one more thing in our lives, right? So it's hard to reach parents with the information, education, even when it comes to things that we know they need, because once a family is in crisis, they're like, oh my God, I didn't know that there was a free teen talk counselor in the high school, and I didn't know this was here, and I didn't know that was here. And we're all like, we're trying to share the information all the time through social media, through videos, through presentations. But let's face it, none of us pays attention to all the stuff that goes by us until it's a crisis, right? Because we're too busy. So I'll stop there.
Thank you, Margaret, for an excellent presentation. I have one question for you. I have some employees who are having a problem with their children because these kids are born here, but their parents are from foreign countries, either Spanish-speaking countries or from Haiti or places like that. And they don't always know where to go. We don't always know when they have problems, but I have one great opportunity. I have to do in-services for them regarding work. I can insert something like this as an in-service for parents, and like this, identify if they have children at risk. Do you have information you can share with me to put together, for example, some of your slides, to put together a presentation for them?
I love that so much.
Yeah, absolutely. We absolutely can. And there are a variety of providers that do have bilingual capacity, Spanish-speaking clinicians and or care coordinators, though they're far and few between, very hard to find, as you can imagine, just providers in general these days, but also Haitian Creole speaking. So I think that's fabulous, and anything that we can do, or anytime you'd like Margaret and I to come talk or whatever, just definitely let us know.
Fantastic, thank you.
And Chantal, I mean, you know, we'll put, maybe Marissa and I can both put our emails in the chat so you'll all know how to reach us. It would be fantastic to work with you on that. And I just wanted to underscore too, that the immigrant families are sometimes the most vulnerable of all the vulnerabilities that we have.
Right.
The city does by having the family navigators at City Hall. If more people knew that that was available to them, because you can walk in, you can call, you can text, you can whatever, and they're at City Hall. It's a free resource that, you know, they're not providing direct services, but they know who everyone is, and they can just be that helping hand to connect people. And they are trilingual in Spanish and Haitian Creole, so they can help people find out what's needed. Also, the Norwalk Public Schools Family Center is really trying to fit that need. I think we really are all trying to have a no wrong door approach. Wherever you go, someone is going to help you, at least to connect to the right place. But the what I know on the substance side, I feel like in the last couple of weeks, I've already had a few reports of recent Hispanic immigrants who don't speak English. The kids come in, maybe they've had, in one case, kid had no high school prior, and it gets dropped into a high school environment, right? No education, no language, and now is using marijuana as a coping skill, and the parents don't know who to talk to, what to do, and nobody has a Spanish-speaking substance provider accessible right away, because that's a gap. But it is easier with the Spanish-speaking population sometimes to find providers. Marissa, you all have Haitian Creole speakers and Spanish-speaking, right? Like at Positive Directions, we have a Haitian Creole speaking therapist who specializes in grief and loss. Right now, we don't have a Spanish speaking person. You know, so Chantal,
Yes.
we will look forward to it.
Absolutely.
Wonderful. Thank you, ladies, for doing such a wonderful and needed work in the community. Thank you.
Thank you. No, thank you for this. I can't type in the chat, but Michelle, will you send everybody our emails?
Absolutely.
Okay. Thanks.
I don't know if there are other comments or questions. I just want to thank you both. I mean, the data is quite amazing, actually, both in all of it, like the things that are looking better and the things that are going in really just such heart-wrenching directions. I have 3 sons that came up through the Norwalk Public Schools, so I appreciate, Margaret, what you said, and really had, in my personal experience, had a lot of positive experience with the guidance counselors and support staff. But we also, so I was also heartened to hear what you said about your partnership with the Norwalk Public Schools, and the various things I wrote. I took a bunch of notes. Now I can't find it, but anyway, a lot of what you were just that was really, because I was concerned that would be a gap, and so I'm really happy to hear that the city has stepped up and the schools too. But that said, I would love to ask if you see it, with the youth, either at any level of the schools, what would be the kind of priority remain, like the existing priority needs, especially if it's a place that in areas that impact some kids more than others, and kind of what are those differentiating, dimensions?
I'm sure we're probably both going to have a variety of thoughts on that, but I think, first of all, yeah, it's been great partnering with the schools, and more partnership. It still needs to go broader and deeper, forever. It's been working well. But one of the problems with all of this work, when it comes to collaboration, is people turn over it and you start over rebuilding relationships, right? I think we all are familiar with that. So there's that factor of just the ongoing need for people's time, right? Can we get, look, we've just had a turnover in another deputy superintendent right now. So that's going to affect everybody's workload and availability to collaborate and so forth. But in terms of the work and the potential gaps or the needs, because the LGBTQ community was at such unbelievably high risk in 2021, in addition to adding counseling, all faculty and staff in middle and high schools got LGBTQ 101 and 201 training through Triangle Community Center, which was incredible. And then this last year, all the elementary school faculty and staff got the 101 training. Fantastic to start building this awareness and support. 101 and 201 are still only about an hour each, but that's a huge amount multiplied by everyone. That's a huge amount of instructional time. But I know we need to keep working on that population and the awareness and the acceptance. And, one of the high schools, there's not even a gay student alliance and so forth. So that's a gap. I know Marissa and I going back to the special needs population, the kids with special needs are at higher risk on the suicide and the substance fronts. And I didn't show you that data. We have a ton of data, but they're at much higher risk. And I haven't seen necessarily a specific focus attempt to say, what are we doing for these kids? How are we helping them differently? What are we looking at? What more do they need? That's a population that I would worry about.
Yeah, and I was just going to say, I know, Margaret alluded to it, and I definitely think that I'm grateful for the partnerships that I see with the city and the district and MPS and the providers, and see a lot of positive growth and movement. And one of the things that I did just want to speak to, and I think it's just in general, is capacity. It is just, it would be great to have multiple clinicians or multiple providers in every school. But the need, again, across the board far exceeds capacity. And there's so many workforce challenges right now in just getting clinicians into schools, into, nonprofits, because they can go to, open a private practice or go work for a private provider, and all they have to do is telehealth and can make significantly more. So if we're talking about kind of broader systemic change, I think it's kind of looking at that workforce space. There's a lot of, challenges in terms of reimbursements and things along those lines that are much larger conversations than this. But I do think capacity is a big issue. And I know, again, I'm really excited and proud to see some of the work that the district is doing, in addition to the city and all of the providers.
The other sort of systemic issue is, of course, funding, right? Which I alluded to earlier by just saying how so much of this is funded through the Drug-Free Communities Grant from CDC. But I also want to point out that some of the great stuff that we've just done in the last couple of years has been ARPA money, right? So it's COVID money from the city. So I mentioned the Teen Nights Out program, and the city funds us at Positive Directions to manage that process and do these events every month. But it's COVID money, so when it runs out, are we going to no longer be able to have free fund social activities for teens? Similarly, last year we had a COVID grant or an ARPA grant from the city, and we at Positive Directions partnered with the Youth Business Initiative, YBI, down in Sono, and we offered gender-specific mental health support groups for girls, then boys, then girls, then boys, one at a time, to really hit a Black and brown. It really ended up being basically a Black population because the Black girls had been at such high risk of depression in our previous survey. We said, let's do something for them. Let's partner because that's the population YBI serves. And in addition, we gave the kids trainings and we had monthly social activities, and we broadened it. So it was like, we're addressing the social stuff, we're addressing skills. There was a smart recovery support group. There was the mental health support. It was a terrific program, ran for a year, only funded for a year. But again, these are things we've been able to stand up, not because we had funding to do it, but because the city, funded us, but the city didn't have funding for it. They were using ARPA money. And again, so I think like whatever we can get grants, when we look at, who are the needy populations, who are, where are the ideas, what can we, I mean, when a grant comes out and people go, what can you do for, X amount of money for a year with ARPA money, people will come up with a project. When we want things to be sustainable, I think that's when we actually need to look at, does the city put some money into something? Is something like this, is Teen Nights Out part of the city budget or the school budget, which is the city budget? Or, how do we do things like that? I mean, Jasmine lives this stuff all the time too.
I have a quick question. Hi, my name's Sharon Benante. I just want to say thank you so much for everyone that put this together and for you guys being here. It's really incredible information. I'm a mom. I have a high schooler at Brian McMahon. I have a middle schooler at CMS. That spreadsheet that you showed, the very last spreadsheet from the North Partnership, showed free services and all of that. I've never seen that before. And I know like a lot of people are out there, they have mental health issues, or their kids do. And sometimes it's like, who are we calling? What are we doing? Oh, I can't afford it. I don't have insurance. So I'm wondering how we can get that out to parents. Maybe I don't think it's on the city site either.
So
it's supposed
to, go ahead. No, go ahead. So it's Margaret, you could talk about the city. I can definitely talk about, I know that working collaboratively with the schools right now to really be able to get that kind of needs assessment and really the service provider map of all of the available resources. I was at a school a couple weeks ago and they had a list of resources, but what they decided to do was like kind of create an app. So families and parents would be able to kind of have access to, just everyone lives on their phones, right? So being able to kind of download that. And so I know it's definitely a work in progress, but I'm so happy you raised that because you hit the nail on the head. Is there are so many resources. It's just a matter of finding them and or getting them easily accessible. And I know it's there's a website that the hub that it has a list of all of these service providers on it as well, but not to go ahead, Margaret. I didn't know if you had one other thing to add to that.
Well, and the hub, so the hub is regional, so they have the services listed from other towns, right? And they're listed on the bottom of that sheet that you were talking about. So it says if you're looking for something outside Norwalk, but that Norwalk list has been, the city has it, the schools have it, everyone has it. We send it out regularly. We update it 2 or 3 times a year if anything changes. And it also lives on the Norwalk Partnership website. So the norwalkpartnership.org /get-help, or just go to the resources page and navigate there. We make it available so that people can download it. It's available in English and Spanish. We circulate it on social media pretty regularly. that list itself is obviously designed to just be a one pager. So it's a lot of words, right? That's why we also have the video that I had in the prior slide that's just like set to music, and it's like slides going by, and you pause it when you want to look at something and, you know, find more resources. But no matter who you send things to, that doesn't always mean they post it. That doesn't always mean they share it. So that's even like an easy peasy thing for you all to help us with, please. Any place you can post or share, any mom's group you're in, if you're on the McMahon PTA, whatever. I actually will be sending it. I just sent the video back out to all the principals last week because we just updated it, and I will probably resend that guide out to everyone and ask NPS Communications to send it out before the holidays. They've been better this year at sending things when we ask them to, and they'll send them to just parents. But again, we all get a ton of messages from everyone. The app idea, the app, I was just gonna say the app, Marissa, sounds really great. And it's the kind of thing where what we want is ideally when, like, if one school's developing an app, like, can that all be coordinated?
Yeah.
Because
Yep.
and the schools and everyone. And the thing is, anytime you create a resource list, someone has to make sure it's updated regularly, because if not, someone creates another resource list and now you have 6 of them out there and they're not all the same.
Very interesting. Thank you. I have one more question. With the legalization of marijuana in our state, and I think we're putting in a store, right, in Norwalk. Is there any?
We have three of
Yeah.
them.
And I'll tell you, it's going to be an issue. I'm hearing a lot about it, especially with high school kids. And kids are taking it as, oh, it's not really a drug, it's legal. So I guess my question is, will there be any funding to offset what is likely to be an uptick? I'm assuming if cannabis is already having a big impact with more of it out there, is there any funding that will offset what might happen?
So it's a great question. The normalization of marijuana has already started to have an impact, you know, nationally and in the state and in what people think. We have been trying very hard to try to educate parents about today's marijuana. I just did a talk at the library 2 weeks ago, and I'd done it previously, but you can't get anyone to come to these things. And people don't know what they don't know, right? The products are not the same as what anyone experienced. I don't care what age you are, whatever was around when you were in high school or college, it is not that anymore. We also know a lot more about what it does to the teen brain, et cetera, et cetera. So educating students is part of what we do with the Norwalk Partnership, what the high schoolers went and did at HONUS the other day. I do professional development for the health teachers. So it's almost easier to get some information to students. It's harder to reach the parents, but the parents, research tells us parents, a willingness to talk about substances with their kids, or lack of knowledge and unwillingness to talk about it, is actually the biggest impact on whether they're going to start using substances or not. So reaching parents, again, huge gap. In terms of the money, yes, the 25% of the marijuana tax revenues at the state level go into a giant fund called Prevention and Recovery Services Fund. And that is supposed to cover prevention, treatment, recovery, and data collection. They have yet to specify how much of that will make its way to communities, although that's something we've been advocating about for 2 years now in legislative forums. In addition, Norwalk, because we are going to allow marijuana sales, we will get an additional 3% municipal tax locally, which will be a cannabis fund managed by community services at the city. And we're working with the city. So Anna Vivian Estrella from the city, she's the head of human services. She's part of the Norwalk Partnership leadership team. And we're all working on, you know, there's going to be money coming. Some of that money needs to go to prevention and education, and some of it needs to go to the police, because you have to do compliance checks in more stores now for like who's selling what to whom. And you've got to look at more impaired driving issues, and you have to monitor the fact that people think you can use it anywhere in public and in restaurants, which is actually not legal. And so there's increased costs. There will be increased costs. There already are. There will be more money. It's the connecting the dots. None of the money, there's no money in Norwalk yet. And the state money has been not really identified as like, should it stay at the state level? Does it go to the region? Does it go to the towns? all of Region 1, which is 14 towns, that's Greenwich to Stratford, just got their first marijuana prevention money from the state that the state has been willing to release. And it was $14,000 for total for 14 towns. Yes, thank you for making those faces. So, advocacy.
Well, thank you
Margaret,
for that.
go ahead, Sharon.
No, I just want to say thank you for that very thorough explanation. I really appreciate it.
I mean, this is stuff I'm living with all the time. So, but again, do want to reach parents. So like, you know, you may not, Sharon, be the only one who's like on an SGC or a PTA or whatever. If anyone wants to invite us to come and talk to families about like what they need to know, there's so many different trainings that we can do for kids, for parents, for community members on mental health or substance or suicide topics for free. So just, it's, you know, if you offer them and people don't necessarily sign up, but if you go to a group and they go, we're going to host this as part of a meeting, you can get some people there. So happy to do that.
I was wondering if you guys have any posters. I had what was successful for me raising my daughter. I had a poster about marijuana, what it does, the negative effects, you know, the injections of the eye, the increased risk of leukemia, the this, the that, what it does to the brain. And I never said anything. She was young. I posted it on her playroom door. So it was there. And then when it came time to talk about it, I knew she has read it. Somehow, I don't know, other parents, the poster disappeared and I don't know how to get another one.
I can send you all kinds of things like that, Chantal. And also we try to post different things and different videos and different images regularly on social media. I do send posters to the schools on a regular basis and to health teachers. And we make, you know, I have an intern who's starting at the end of January, thank God, which is going to help a lot. But, you know, whenever the interns get here, I'm like, make a reel and make a video and put some more stuff on social media.
Exactly. It's a good subliminal. That's how I went, a good subliminal way of getting her to know this is not all hunky-dory, a beautiful drugs. Yeah, it has bad side effect.
Yeah.
Thank you.
Well, I hope you'll all, you know, subscribe to the norwalkpartnership.org, or follow us on Facebook or Instagram. And it's the Norwalk Partnership. It has the word "the" in it. But then you'll just see things like this and you'll get the resources. And when they're updated, then please just share them back out, because again, it's all about trying to disseminate information. So sharing is caring.
Absolutely. Thank you.
Thank you.
Margaret, we just had a question from someone Diane Loricella, who's watching as a resident of Norwalk. And she was just wondering how she and the public can access some of your great data points from your slideshow. I can connect you all via email if that's easier, if you want to provide a link, but otherwise, I don't know if there's some a place you would direct her to.
Yeah, for these slides, I can put them on the website, or I'm happy to send them if you want to connect me to Diane. On the Norwalk Partnership website, there is a place, actually, you know what I can do? Let me share my screen again for a minute so I can show. Because what I'm going to do is briefly show you the website and show you where you can find some of these things that we've been talking about. Okay, so here's the general website and here are the areas. So first of all, anyone can join any of our meetings. They're public. Here are where, for example, since we're talking about mental health, if you go to the mental health page, which I noticed, by the way, it's a little glitchy in terms of the sizing of some of this stuff recently, but like there's videos. This is a video of just warning signs. This is a video we did during COVID to raise awareness about our local data at that time. Here's an infographic of the most recent survey. We thought these were the most important mental health points for people to know over here. And then if you download it and print it, on the back, here are all the key resources we want people to know. You know, so there's a lot of information on the website. And then over here under resources, you can actually access most of our presentations right here. So maybe I'll just throw this presentation up over here on the presentations page. And you can also go get raw data, like the actual full data reports back here, including previous data from 2021 and the very first Norwalk Youth Survey, which was 2018. So all of this is publicly available on the website. And then also under the resources page, you can go to the training resources and see any of the different kinds of trainings that we can offer. And you can see there are a lot of them. So, you know, I would encourage people to visit the site and get information. Here's also where you can find out about the teen nights out and the teen clubs and so forth.
Thank you so much. Any other questions for Marissa or Margaret? No, well, I emailed everyone both of your email addresses in case they have questions to
Thanks.
follow up. But thank you guys so much for providing this incredible information and for your time tonight and everything you do for the communities.
Yeah, amazing. Thank you very much.
Thank you.
Thank you all. And thanks, Michelle. Thanks for setting this up. What a nice opportunity. It was great to meet everybody.
Absolutely. Bye. Thank you, everyone.
Thank you.
Have a great
Bye-bye.
night. Thank
Thank
you.
Thank you, everyone.
too.
Thanks.
Great. Well, thank you, Michelle. That's amazing. So we'll just move along given the hour. And I know we already lost Yvonne, seems to, maybe she had an 8 o'clock conflict. So the next item under new business is the Community Outreach and Civic Engagement Committee. So I don't think we have an update. We actually did not meet in October, and we determined via email that the meeting date and time was not convenient for pretty much anybody on the committee. So we're trying to find, Yvonne did a what do you call it, a doodle poll to try to find a better time. So I think we'll kind of at this point hold until the new year and regroup, set a better time that works for folks. Unless anybody has anything to chime in on that, we'll just move along. Okay. Diversification of Boards and Commissions Committee.
That first updates on the Norwalk Award ceremony isn't part of our committee, so I'm gonna kick that back to you, and I don't know.
Okay. I can come back to that if you want to give an update. Okay.
Sure. Our onboarding doc is like 95% done. At this point, I'm probably gonna ask for a meeting with Michelle and Claudia just to review it, and then if we can meet with Latoya to ask the city to see how they want to work with us on that document, because there are some areas that they can plug in information. And I will follow up with an email trying to schedule time with you, Claudia and Michelle.
Great. And Sharon, did you wanted a goal of yours? I think you mentioned in an email was to do that before the next January meeting, or what were you thinking?
Well, I would love to squeeze it in December if we can, just because then it gets crazy again at the beginning of the year. And so if there's a possibility we could all get together before the end of the year, that would be great.
Perfect.
Yeah, Sharon. I think we should be able to squeeze it in.
Excellent. That's all we had right now.
Okay. And I'll also, I mean, I have time. I can make myself available, Sharon, to meet on that. So.
Perfect.
Okay, so on the Norwalk Awards ceremony, so at our last meeting, we agreed we would do something on March 11th, which would be our, assuming we keep the same cadence of monthly meetings, that would be our March 2024 meeting date. And we would keep it low key, not a fundraiser. And Christina was going to give some thought to some nomination concepts and a timeline. So, and we're going to touch base on that. But Christina, did you want to share anything on that?
Sure. I did fall a little bit behind. I am very sorry. I will have something, actually a form, a sample form in a Word doc by the end of next week to everybody, if not even this week. So it's a priority, and I apologize for falling behind. So I will have it available on a Word document. And then one of the things I'll just need to know is who would have a SurveyMonkey account or a Google Doc account. and or whatever platform is best to collect the nominations. So I think an online nomination form will be make it easier for everybody involved. So I guess, Michelle, maybe I would connect with you to find out what the platform would be that then I can put the Word document onto an online form, whether it's Google Docs, SurveyMonkey. I can learn new platforms too if necessary. So just an FYI. So the thought process will be that December 22nd, the nomination form will be finalized. So you'll all have it before then. January 5th, we can begin the promotion of it, of the impact awards is what we were calling them. Nominations would be due February 23rd. Recipients would be chosen by March 1st. And then March 11th is the awarding, as Claudia said at our regular meeting. So in the nomination form, I will take a stab at criteria. I'm just confirming we were talking about sort of a youth and an adult award and impact on that resonates with the commission's mission. So that's the update that I have at this point. Any questions, concerns, reactions? Excuse me.
Go ahead, Michelle.
Okay.
No, I was just gonna say, Christina, yeah, happy to help you with the form offline, but yeah, that sounds great.
Yeah, I agree. That sounds great. And I think then I can follow up. I know, Michelle, you had said at our last meeting we could do this at City Hall, but then subsequently had some other suggestions from people at a community meeting that where you were as a possible location. So we can kind of, again, offline, sort of move that forward, the logistics of it. So we can also, and also kind of start a, invite list of, even just the partners we were just talking, the folks we were just talking to, and kind of other people to let people know about it, because it would be great to kind of get a good showing for it,
Actually, that's a good point. Would someone be able to maybe start to generate a list of agencies or organizations that there are groups that have existing lists, right? So I wonder how we can collaborate to maybe get an email list to contact other agencies to let them know about the award. So that I'll put that in some of my suggestions for the write-up as to where the nomination form can go, sort of an outreach, and maybe someone here in the commission can kind of think about doing the outreach for the survey. So, okay, thank you.
And just to add, in case you're interested, I think 2 ways the city can help is the Community Services Department has a full list of community organizations and nonprofits that we partner with that they do email blasts to. And then the business community has a list of businesses as well. In case you're interested in that list too, we can absolutely help.
Great, thank you. I think those 2 lists would be perfect. And then social media as well, of course.
And I think if we can could we get something, could the city help get something out to the public schools too?
Yeah, we can definitely ask them. Yep, because I know
or the high
to
schools.
remind me, but one award is for the youth, right? So that,
correct.
I think you guys talked about working with teachers, right? So I think once we get a little deeper, I'm sure Norwalk Public Schools communications team will definitely help.
Okay, that would be great. Yeah. Excellent.
So my question is, the list that you were just talking about, is that to get the nominations, or is that like an invite, or both?
Could be both.
Could be both. Okay.
I think we'll have to make that, well, I think that we'd have to determine that. And I guess the other thing is there at least one other person on the commission that would want to work with me on this? That would be helpful to have kind of another kind of a task, even if it's a task force of 2, would be helpful.
You mean on
I
the
can work
nomination?
with you.
Okay.
I'm sorry, was that Chantel?
Christina, yeah, I can work with you.
Okay, great. Thank you.
You're welcome.
That's
Work
fantastic.
with you too.
Great.
And I was already working a little bit with you on that. So I'm happy to be part of that. And Jasmine, I was sort of saying like an invite list separate from, I mean, I wasn't really thinking about that, like where the nomination form or kind of do an email blast to let folks know that this is happening and to please submit nominations. But I think there would probably be some overlap between those two lists. But I think if there are other groups that we know of that, you know, we would want to, and maybe again, maybe like you said, Christina, maybe it's the same list, but
Yeah, have we kind of thought about who should be nominating? Maybe not should is the right word, but who has the option to kind of nominate someone? Because we want, is that gonna come like it's like with the form like for eligibility, but like who gets to nominate? Like, can I nominate my mom? Can someone like, can I nominate my teacher? Like who's doing the nominating? Is it just like the average public? Is it providers? Is it, who's nominating?
I think I had understood the intent to
Mhm.
be the public to nominate.
Anyone.
And then, right.
I just
And
a
then
resident or normal.
well, based on some criteria, right? So that's what I was going to start to draft up.
Okay.
But yes, I definitely do think it would be open to the public. I think that's sort of what I think that's what the original intent was, I believed, with the concept of the award.
Okay.
yeah, that's my understanding. We'd only really had the one conversation that Michelle and Ashley and I had, but yes, that
Right.
was, yeah.
All right. And one adult and one child, just sorry.
Yes. Right.
Or youth, right?
And it would be that their actions, their actions have sort of had an impact on women and forgive me, I'm drawing a blank on to making sure we're using the proper language, but to make sure we're using women and identifying as women, the impact on those communities. That's really what we were looking at, is improving the lives of women and women who and individuals who identify as women.
And so then I think, yeah, the form could include like a brief explanation of what that
Right.
person has done,
Correct.
right? That
Right.
if the nominating person's opinion makes
Right.
them kind of like,
That's what would have to say.
stand out.
Yeah. That's
Yeah.
what the examples that I've seen have said. It's like, please describe how this person, this award is for X, Y, and Z. Please demonstrate to us or share with us how this individual has had an impact in this area.
Yeah, perfect.
Okay.
Good. That sounds great. And so,
I'm sorry,
yeah,
can I
sorry.
add something? And
Yeah.
if we could just add non-binary language in there so
Yes,
that
yeah,
also open to
absolutely.
non-binary. Thanks.
Thank you. Thank you, Sharon. Yes,
And I
my
think we
brain
can,
was not working.
we have that language in our improved,
In our mission.
yeah, and with the
Correct.
changes that we made. Yeah. Great. And I think that the timeline you set out, Christina, is great. It's a little accelerated now, but we'll be in good shape by the beginning of January to kind of launch it and get the nominations in. And one thing we discussed last time is that the commission would review the nominees and make the final decision. So, so we can do that. We could figure out the process for that. And yeah. Great.
I would maybe too would be helpful, like the task force. Like if we got 100, right? Do you think we should like read some out so that the whole commission isn't going through 100? Should we bring the best 50 or the best 25 or something? Isn't when
My thought is that I think we need to see what our initial response is to some degree. I mean, I think we have to have a plan for that. But I think some of the granular details that we're getting into are probably best for the task force to decide.
Yeah.
Okay.
Yeah.
And I just called it a task force committee, whatever same difference.
With
But I
that,
think that's smart. Yeah, we can see, as you say, Jasmine, I think if we
Given
do
the
get like a
timeline.
sizable number, we can whittle it down to, whatever, 3 or 4 or 5 per award that we can present to the full commission for consideration and a final decision. Otherwise, it'll just be massively time consuming times X number of commissioners. So Yeah. Good. Okay, where are we? So I think okay, so that was the updates on the award ceremony and nomination process. Old business. There is no old business from the Community Outreach Committee, unless anybody has anything. Diversification of boards. Any old business, Sharon? Or others?
Yeah, Christina was going to.
Okay.
Sorry, it's
Bless
starting
you,
to have a
Christina.
tube thing. Thank you. Just reiterating, and I'm not sure if Diane is still on, but we are pointing out and highlighting the fact that we still have 3 vacancies. Correct, Michelle, right? 3 vacancies on our, or 2, sorry.
2, but
Yeah.
I actually just got an update today that's that the Common Council has on their agenda for tomorrow, approving the potential appointment of Jessica Edward. So Jessica, I don't know if anyone has met her before, but she is the CEO for Caring for Seniors, and does a lot of healthcare work about helping the elderly or aging population gain more independence and access to healthcare. So I learned that that was on the agenda for tomorrow. So we'll learn if she gets approved.
Okay. So in the event that she does, then we would still have 1 opening.
Yes.
And would the 1 opening need to be unaffiliated, independent, unaffiliated Republican or Democrat?
They would have to be either an unaffiliated, an independent, or Republican.
One of those 3. Sorry, one of those 3.
It's
Okay.
confusing. Yeah. Thank you.
Okay.
Thanks for asking.
So please let us know if you do have any nominations and let Michelle know.
And I also, if I can add to that, the last meeting that we had with Robert Sowers, Robert mentioned that there's an opening, there will be openings for an advisory board for the Rec and Parks Committee, for Recs and Park. Will actually be an advisory council, from what I understand. So if anybody knows anybody who has experience as an athlete, maybe a student athlete, somebody from Norwalk, somebody who cares and can put on the gender equity lens with sports and programming, please talk to them about getting in touch with Robert for that advisory board. Thanks.
Yeah, thanks, Sharon. Good. All right. Any other business? So one quick request, Michelle, and forgive me if you already sent this, but last year you sent out for 2023, the dates of all of the meetings. Could you do that again for next year?
Yes. Thanks for the reminder.
That's super
Good idea.
helpful. I have it right next to my desk. So
Yes, definitely.
great. Okay, that's great. All right. So unless there's anything else, I think we have a lot that we're all working on offline, so to speak. And thank you all for being here and your attention and engagement. Michelle, thank you again for bringing Marissa and Margaret, inviting them to join us. It was such a powerful presentation. And I will, I guess I take a motion to adjourn the meeting.
Motion to adjourn. There you go.
Is there a second? Okay, great. Motion adjourned and seconded. All in favor, say aye or raise your hand.
Aye.
All right. Thank you. That is unanimous. At 8:28, we adjourn the meeting. Everyone have a wonderful holiday in whatever way you celebrate, and just a lot of appreciation and gratitude for all of you. So take care and we'll be in touch.
Thank you, Claudia.
Thank
for
you.
everything.
Take care, everyone.
Bye, everyone.
Bye.
Bye-bye.
Bye-bye.